Good morning, 20-second hand hygiene. My name is Jonathan and I'll be your nurse for today. Can I get your name and date of birth? Okay, let me confirm with your wristband. Billy Bob, 1972. How's your morning going, Mr. Bob? Okay, that's good. Are you in any sort of pain right now? No pain? Perfect. And are you allergic to anything? More specifically, are you allergic to latex, chlorhexidine, or tape adhesive? No? Okay, well, the reason I'm asking is because I'm here to change the dressing that you have right there. Is it okay if I can expose the site? Okay, thank you. And have you had this procedure done before? No? Okay, well, I can educate you real quick. So what you have right there is CVAD. It stands for Central Venous Access Device. And with this catheter leads to your heart, and we use this to administer different types of electrolytes, fluids, and medications. Throughout the procedure, if you feel that you're in pain, let me know and we will administer pain medication. But other than that, any comments, questions, or concerns? No? Okay, so what I'm gonna do right now is I'm going to clean the table for 30 seconds and we're gonna let it dry out for 2 minutes. Okay? Did you have breakfast already? You did? Did you like it? What'd you have? Oh, you didn't like the food? Well, you can always tell family to bring you food if you would like. That's always an option. I know the cafeteria food isn't always the best. We're gonna clean the sides all the way around. All the way around. So while we wait for this to dry, I'm gonna go more in depth on what's gonna happen. So I'm gonna remove the dressing. I'm going to assess the site, make sure the tubing's all right, make sure there's no inflammation or swelling, and make sure the length of the tubing is the same as it was 7 days ago. Here at this hospital, we change the dressing every 7 days. It varies from hospital to hospital, but here we do it every 7 days. So we're also going to remove the bio patch and then put a new dressing on top. But before we get to that, I do want to remind you to keep your mask on and to turn your head to the left. This is just so you don't breathe on it and cross-contaminate the area. Also, I want to get you in the best position of comfort. Are you comfortable right now? No? Okay, well, let me lower the head real quick for you. Let me know when you're good. You good? Okay, perfect. And if you can turn your head to the left. Perfect. Okay. So what I'm going to do right now is I'm going to gather my supplies. We have our bio patch and our tray. Okay, so what I'm going to do right now is I'm going to put on my gloves and remove the dressing. Remove the dressing. How you doing so far? Good? That's good. We're almost done here. Remove the bio patch. Okay, so now I'm going to assess the site, make sure there's no redness, inflammation or swelling. Make sure to take a look at the tubing. There's no crack or any leakage going on. And make sure the length of it is the same as it was 7 days ago, which is 5 inches. So far, so good. Okay, so now what I'm going to do right now is I'm going to put on my sterile gloves, and I'm going to clean the site 2 inches around for 30 seconds. Make sure to clean the tubing, and most importantly, we're going to have to wait 30 seconds and let it dry. Okay. Okay, so now what I'm going to do is I'm going to hold this with my left hand, and because I'm holding it with my left hand, this is now the contaminated side. I'm going to grab this Chloro Prep, make sure to crack it and clean the site for 30 seconds, 2 inches around. Make sure I clean the tubing. And last one. Okay, make sure to throw this away. I'm gonna let it dry for 30 seconds. So far, so good. Okay, next what I'm going to do is I'm going to apply the bio patch. Taco side up. Taco style. Okay, ready? 3, 2, 1. Okay, perfect. Now what I'm going to do is I'm going to apply the Tegaderm. I am going to leave the wrapper right by your face, but I'll throw it away afterward. Okay? Thank you. Make a stress loop. Make sure we remove any air bubbles. Okay. Make sure I keep this because I need to put my initials. Okay. Okay, we're almost done here. So now what I'm going to do is I'm going to document everything, that I cleaned the site, that I didn't notice any redness, inflammation, that the tubing's all right. And yeah, I'm going to discard all my supplies. Do hand hygiene. Any comments, questions, or concerns, Mr. Bob? No? Okay, well, now you can turn your head back straight. Okay, I'll cover the side. Like I said, I'm going to be documenting. And if you need anything, let me know. The call light's right here. And I'll be back to check on you in a bit. Thank you.